All right, now we're going to start looking at the current responses that we have as well as additional response options. And I want to welcome Amelia James from Knoxville Heart joining us this evening. And I think Mr. Johnson is going to pull up your slides right now. But welcome. We're glad to have you here.
Thank you. I'm so excited to be here and really excited that we're all here talking about mental health and that there's such an interest in both the city and county to do this. So my name is Amelia James. I'm a licensed clinical social worker. I manage one of our behavioral health programs at one of our community nonprofits, and I have been working as a therapist for the past 7 years, primarily with people experiencing significant mental health issues and substance use issues too. I am a member of Knoxville Heart, so if you want to go to the next slide. Excuse me one moment. All right, so who is Knoxville Heart? Some of you are very familiar with us, and some of you probably have never heard of us before. So our mission is to advocate for an alternative first response team in Knoxville to improve outcomes for people in crisis and reduce demand for police involvement. So what I'm going to be talking about today is alternative response teams. And again, some of you all might know what that is and some of you don't, so this will just be a brief overview. And we also have packets of handouts for you all after this so you can take home. And we're always happy to answer any questions. But basically, Knoxville Heart is a group of volunteer community members, and we've been working together since summer of 2020 to advocate for alternative response in our city. Our group is composed of people with lived experience, those who have been affected by policing and have had contact with the criminal justice system. We also have behavioral health clinicians and other dedicated community members. Throughout the years, some of the things that we've been doing is we've conducted focus groups with the community, we've talked to people with lived experience, we facilitated a community de-escalation training, we've met with various business owners, various key government officials, the chief of police, and we've consulted with 2 alternative response teams across the country, Cahoots in Eugene, Oregon, which I'll mention several times. They have been running an alternative response team for the past 30 years, or over 30 years, and Denver Star, which has a newer alternative response team. And recently, we contributed to the successful passage of 2 city council resolutions affirming alternative response, which is one of the reasons we're here today, so we're so excited. So if you want to go to the next slide. So what is alternative response? At its core, it is pairing a medic or an EMT with a behavioral health professional who are dispatched by 911 as emergency responders. And they have a van that indicates what they are and a van that's outfitted to meet their needs. So if you want to go to the next slide. So how does this all work? Okay, how does alternative response work? First step is someone calls 911, and the 911 dispatcher has training to triage that call. And if they identify that this call would be appropriate for the alternative response team, they dispatch that alternative response team. And the key thing is that team is dispatched without police. So that is one of the main differences from all the other services, we've heard about today. Now, you do see the police car up there. What is that about? Just because they're dispatched without police doesn't mean there's not collaboration when needed. And so the alternative response team can call for backup if they get into a situation and realize we do need police here. And what we know from other alternative response teams around the country is that they need police backup less than 1% of the time. So hardly ever, but it is there as an option, which is why this is, in some ways it's collaborative, right? But 99% of the time they're responding without police. So what is it that team is doing? First, they can provide things like basic first aid and meet basic needs. They can also do things like provide psychological first aid, crisis intervention, de-escalation. And what we know from some other teams is that about 74% of the calls, the people are able to stay safely in the community. But sometimes, people need higher levels of care, so they might be transported to the hospital, to the CSU, to some of the other incredible services we have in our community. So that is kind of the flow of an alternative response team. So you want to go to the next slide. So why are we so passionate about this? Why have we as a group spent 3 years of our lives trying to make this happen in our city? So we have 4 main points. The first is alternative response improves outcomes for those in crisis. So police presence can escalate those in crisis no matter how well trained that officer is. And we also know that people with serious mental health issues are 16 times more likely to be killed in a police encounter. Research also shows that CIT training, while super valuable, and we're so glad we have it in our community, research shows that it doesn't have significant effect when we look at outcomes like arrest, use of force, or injury rates. So when we're able to meet people's needs with a specialized team, like an alternative response team, we can improve those outcomes. The second point is it saves the city or the county, if they are involved, money. So Cahoots in Eugene, Oregon saves the city approximately $8.5 million a year. And I think it's important to note that Eugene is similar in budget and population as Knoxville. So while programs like alternative response do require an initial financial investment, they ultimately save millions of dollars. And so just think about what Knoxville could do if we had an additional $8.5 million a year. That's pretty significant. The next point is that it reduces burden on police officers. So we had a lovely meeting with Chief Noel. Chief Noel is absolutely in support of alternative response. And he told us that there are so many calls that his officers go out to that do not require them to be there. And so they're having to respond constantly to these calls. We know that police response is expensive, and they're showing up and going, we're not really sure, we don't need to be here, or this person has mental health needs that are so significant that now our capacity is outmatched. This doesn't meet our skill level. And the department ultimately is really stretched thin. They're having to constantly use overtime. Cahoots in Eugene responds to 17% of all the calls that the Eugene Police Department gets. So imagine how things would change for KPD if they had to respond to 17% fewer calls, what that would do for the department. And then the last point is that alternative response repairs trust with the community. So many people here might have had really wonderful experiences with police. But I do think we need to be cognizant of the fact that that is not the experience that many people have. Okay, so people with severe mental health issues, people who use drugs, black and brown people, trans people, and others have really long histories of negative experiences with the police. And so for individuals like that, when an officer shows up alongside a behavioral health professional, like in co-response, sometimes what that can do is make that individual not want to seek care anymore and not want to seek mental health care, period, because now they see that mental health professional coming with police, and that is something that is very scary and threatening for them. Something that Hart learned in our meeting with McNabb is that, one of the main gaps of service is looking at how many people aren't even calling 911, right? How many people in our community desperately need crisis care and support, but will not call 911 because they're very scared, and often for good reason, unfortunately, of what will happen if an officer shows up. So this is the main gap in service, right? We do not have a first responder system that responds without police. And that is a huge gap when we're thinking about our folks in our community who are dealing with substance use, mental health, who are unhoused, who need care. And so this is why we're so passionate that alternative response could meet that need. If you go to the next slide. So what does an alternative response team respond to? What kind of calls are there? And I want to say, so this is data pulled from Cahoots, which again, they've been doing this for 30 years. What we're proposing is a pilot program, which means we don't have to respond to all of these types of calls right off the bat. We can prioritize. But this is a vision of what an alternative response team could do in our community. So the first is they respond to mental health crises. They can provide things like psychological first aid, crisis care, and de-escalation. They can provide substance use counseling and also dispute mediation and conflict resolution. There's so many times where, tensions are high, people are having a conflict, and if that can be safely de-escalated, people can go on their own way, right? So this mental health crisis, that's where that behavioral health professional really shines. Then we look at basic needs and assistance, things like providing food, water, socks, basic supplies, also first aid and non-emergency medical care, things like wound care, basic first aid, and transportation to services. So this is where that EMT or medic really takes the lead, right? And then we look at social services and community support, doing things like welfare checks and connecting people to resources and other referrals. So this is that sort of case management piece. And then the last is general public service. So things like grief and loss counseling or supporting other first responders when they call for alternative response team backup. One thing that happened in Denver is they had this pilot program, Denver Star, going, and the police officers started going, can we have more of this? Because like we want to call them for backup all the time, right? So this is, again, this is something that like is not, there's no animosity between any other programs. This is like fitting in another service that could help in our community and that can work collaboratively with our other systems. So you can go to the next. So what is it that we are proposing as Knoxville Heart? What we would really like to see is assembling a task force with key community stakeholders to plan an alternative response pilot program. Cookeville actually has just gone through this planning process. And I believe that took them, don't quote me on this, but about a year to plan their own alternative response team. And so it takes time to bring everyone together and figure out how do we want to make this happen. So part of what that task force would do is identify a community partner or an organization with the necessary values and commitment to non-police response. So we really need an organization that shows like we understand the trauma-informed care, the harm reduction, and we understand why it is so essential that police not be responding alongside this team. The next step would be to launch the alternative response pilot program. In Denver, they did a 6-month program. During those 6 months, they responded to 700 calls and called police backup 0 times. Hugely successful. Denver then said, we're going to invest several $1 million to expand this team because we love it so much. Throughout this whole process, we would advocate for transparent data collection and dissemination to evaluate the program. So many times, programs are started and then we don't really hear much about them, and we don't really hear about the data and the outcomes, and that is essential for any pilot program, both for transparency and community trust, but also to say, like, how do we improve this program? What's working and what's not? And throughout this whole process, we value continuous community feedback and emphasizing voices of people with lived experience. You know, I have 7 years experience doing this work. I think I have a pretty good grasp of what my clients go through, but that is not the same as being someone with lived experience. And so those are the voices we have to center in this entire process. And without that, it just will not be successful. Programs like this are not successful without community buy-in. So that is what Knoxville Heart is passionate about, why we care so much about this program. And if you go to the next slide, this is where you can learn more, knoxvilleheart.org. We also, Alex is going to pass out packets for you all that have more research, more articles, lots of information, and we are just really happy to answer questions and passionate about getting this program in Knoxville. Thank you.
Thank you so much.